is a system of glands and hormones. And so overall, the function of the endocrine system is what? Okay, secrete hormones. For what purpose? Right, so primarily to maintain homeostasis. So you should have an idea of how this system works. Your endocrine glands secrete what? Hormones, and secrete them where? Into the bloodstream. And once in the bloodstream, they circulate throughout the body, but they have an effect on target cells and target organs. Good. So target cells and target organs are able to respond to the hormones because they have what? Okay, so I should have asked you all that on the quiz instead of asking you to name the glands. Okay, so the endocrine system, so that's kind of the overview. You should know what organs make up the endocrine system. And those are going to be obviously the glands. And there are tissues that respond to those hormones. Hormones are just chemical messengers. So once they bind to the target organ responds in a specific way. Okay, so the main thing I want to go over today, last week we went over the specific effects of the hormones, and today I want to emphasize a little bit more about those effects and what happens if there is something that goes wrong, if a particular gland is secreting too much of a hormone or not enough of a hormone. So disorders of the endocrine system is what I want to emphasize today. But also make sure you know for the test the difference between endocrine and exocrine glands. And what are the exocrine glands that you all learned in 201? Sweat glands. What else? Lacrimal glands. Mammary glands. Oil glands, right? Sebaceous. Okay. So also the pancreas has exocrine function, but hopefully you know the difference. So what makes the pancreas with exocrine and endocrine function, what makes those functions different? So you have one organ that acts as an endocrine gland and an exocrine gland. So what this slide is showing you is that the pancreas produces insulin and glucagon by way of specialized cells here called islets of Langerhans. And so those parts of the pancreas secrete insulin and glucagon, and that those hormones are picked up by the bloodstream and travel throughout the body. Whereas the exocrine function of the pancreas is to secrete digestive enzymes that break down our food coming through the intestines. And what happens is those parts are, this is the exocrine glands, and they secrete into this duct that carries the secretion on into the small intestine. So we'll talk more about those in the digestive system chapter. Okay, so of the hypothalamus and pituitary gland, there is an important connection between those. One, the hypothalamus stimulates the pituitary gland to secrete hormones at a particular time. And also the hypothalamus is where ADH and oxytocin are actually made. So ADH and oxytocin, remember those two hormones? So they're secreted from which of the glands? Very good. So the posterior pituitary gland is responsible for secreting those hormones when they're needed. But keep in mind that they're made by the what? Hypothalamus. So the hypothalamus makes ADH and oxytocin, and then they're sent to the pituitary, the posterior pituitary, to be stored until they're needed. to be released. Okay? And then there are also regulatory hormones that come from the hypothalamus. And I'll show you those in a moment. So these are just the other glands and the hormones that they secrete. Okay? So now they come back to you. Thyroid gland, adrenal gland, pancreas. And if you had put up here the organs with secondary endocrine functions, I would have given you credit for those as well. All right, hormones. Let's move on to control of the pituitary. So again, the pituitary hormones, the pituitary glands are controlled to a great degree by the hypothalamus. So if you look at this picture, at the top here is the hypothalamus. So you see the green arrow at the top, step number 1. And what happens is the hypothalamus sends a signal to the pituitary gland, telling the pituitary gland when to secrete these hormones. Okay, so that's an example there of how the hypothalamus is important in regulating the control of the pituitary gland and hormonal control. So if you all remember from chapter 14, I believe, one of the functions of the hypothalamus was to regulate the release of hormones. Remember that? So here's how that works. Now with the negative feedback, so what this slide is showing you is how negative feedback helps the body to maintain a balance of thyroid hormone in the blood. So if thyroid hormone is needed in the blood because it drops too low, you have first the hypothalamus, which is going to respond to that drop in thyroid hormone. Okay, so drop in thyroid hormone activates the hypothalamus, and then the hypothalamus can do something, and what that does is sends another hormone. It's called thyroid releasing hormone, which is a signal to the anterior pituitary gland. So the anterior pituitary gland gets the signal from the hypothalamus that thyroid hormone is too low. So the anterior pituitary gland releases what hormone? TSH. Remember what TSH is? Thyroid stimulating hormone. So when the anterior pituitary gland releases thyroid stimulating hormone, what happens? That TSH does what? So it stimulates, TSH stimulates the thyroid gland to secrete the thyroid hormones, which we're talking about T3 and T4. Okay? So let's go through that one more time. So this is negative feedback. A drop in thyroid hormone is going to stimulate an increase in thyroid hormone production. Okay? But before thyroid hormone can be released from the thyroid gland needs to get a signal. So the thyroid gland gets the signal from where? Directly. Well, we can start from the top. So first the hypothalamus reacts to there being too little thyroid hormone. And what does the hypothalamus do? Send a signal to the anterior pituitary gland, okay? And it sends the signal, which is another hormone called releasing hormones. So the hypothalamus secretes releasing hormones and inhibiting hormones to turn on the release of a hormone and to shut off the release of a hormone. So TRH, thyroid releasing hormone, is what tells the anterior pituitary gland to release TSH, thyroid stimulating hormone. And once the thyroid gland gets that message, it knows to go ahead and start what? Secreting thyroid hormone. Okay? So now the thyroid hormone levels are increasing. So eventually there's going to be too much. So what's going to shut this off is negative feedback. So once the hypothalamus senses that there is enough thyroid hormone, then the hypothalamus stops sending what? A signal to the anterior pituitary gland, so the process is turned off. And we talked about oxytocin before. Oxytocin is released when the cervix starts to, or the uterus starts to contract, and the cervix starts to stretch. And what that does is stimulate the release of even more oxytocin until the baby is delivered. So that is an example of positive feedback. Do you all understand what negative feedback and positive feedback mean? Negative feedback is where if there's a change in one direction, negative feedback brings it back down to the normal state. And positive feedback is where if the change occurs in one direction, it keeps going in that same direction. Okay. Hormones and receptor regulation. You have downregulation and upregulation. So in downregulation, the presence of a hormone may trigger a decrease in the number of hormone receptors. When levels of a particular hormone are high, cells become less sensitive to it. And where this is most notable is if when people take drugs, sometimes the drugs become less active. So if there's too much hormone, then sometimes the cells respond to that by pulling away receptors. So remember, it's the receptors that the cells have that actually responds to the hormone. So if they feel like they're being bombarded by too much hormone, they take away the receptors so they don't continue to react be overly stimulated by the excess hormone. And that's called downregulation. And that happens when people who are on drugs, for example, if they take the drug for a while, it's not as effective in getting them high, for example. And that's because whatever cells that have receptors that are responding to the drug are becoming overwhelmed, so they take the receptors away so they don't respond as strongly. And then if there's a shortage of a hormone or a shortage of a drug, so if a person stops taking a drug for a long period of time, the cells start to make new receptors, so that receptors increase so that they can still get some stimulation from low levels of the hormone. And that's called upregulation. So this is kind of a good thing just to have an idea about. I don't think I'll ask you about it on the test. But just to know how our body cells are able to respond to there being an increase of a hormone or a decrease of a hormone. And this is going to be important to you all at some point. All right. So the pituitary gland, again, has the anterior and posterior. I believe I spoke to you all about tropic hormones. And tropic hormones stimulate the release of other hormones. So a tropic hormone is a hormone that is released, but its job is to stimulate another gland to release another hormone, just like TSH did. So TSH would be a tropic hormone because it stimulates the thyroid gland to secrete what? Thyroid hormone. Okay, so here it just tells you a little bit more about those releasing and inhibiting hormones that come from the hypothalamus to control hormonal release from the pituitary, anterior pituitary gland. All right. Now, what I wanted to get into are some of the effects of endocrine glands over-secreting a hormone or under-secreting a hormone. And so the first thing you all need to do is learn the glands and the hormones and the effects that the hormones have on the body. For example, did you all bring your table with you? with the hormones. Find for me calcitonin and PTH. So what gland secretes calcitonin? So the thyroid gland secretes calcitonin, and what about PTH? So the parathyroid gland secretes PTH. So the first thing you need to know is what effect calcitonin has on the body, which is what? So it decreases blood calcium. And what does blood calcium mean? Just to make sure y'all understand what that means. Exactly. How much calcium is in the blood? That's blood calcium. So if calcitonin lowers blood calcium, then you would expect for the thyroid gland to secrete calcitonin under what conditions? When blood calcium is too high. Good. Okay. What about PTH? What would you expect for the parathyroid gland to secrete PTH? When it's too low, what is it? When blood calcium is too low. Thank you. So when blood calcium is too low, the parathyroid gland secretes PTH, which does what? Increases blood calcium. Okay? So now, once you have that, now you have to take another step. What happens if something happens to the parathyroid gland and it's not able to secrete adequate PTH? What will be the effect of that? Just off the top of your head, from knowing what it's supposed to do. If it's not there, what happens to blood calcium? So if there's hyposecretion of PTH, not enough PTH, since PTH is supposed to increase blood calcium is going to end up what? Falling too low. Okay? Maybe even fatally low. So this would be a very serious condition, which, and I'll show you in a moment. So if you have a drop in calcium, remember, where does the calcium go? If there's a drop of calcium in the blood. So what PTH is supposed to do, for example, is increase blood calcium, but how does it do it? Where does the calcium come from? Bones, remember? So the bones are calcium reservoirs. So if there's not enough calcium in the blood, some of the calcium is taken from bone and sent into the blood. But so what happens then is, if there's a decrease in calcium, or let's just say write down this word, hyper, so you have an idea what hyper means, right? What is hyper? The prefix hyper. Hyper. Right, so higher than normal. So hyperparathyroidism. Just look at that word and see if you can figure out what that means. Hyperparathyroidism. No, what does the word itself mean? Without calcium, don't even think about calcium, just that word. Hyperparathyroidism means what? Don't tell me anything about calcium, just tell me what that word means. That's going to be the effect. Y'all are talking about the effects of that, but the word itself means hyperparathyroidism. Oversecretion of parathyroid hormone. Okay? Hyperparathyroidism. Right? And what about hypo? parathyroidism. So the parathyroid gland is not secreting enough PTH. Okay, now tell me what that's going to do to calcium. So once you know what the word means, you have to do that first. So if there's not enough parathyroid hormone, then that's going to cause blood calcium to what? Right, so you have to keep thinking back. Okay, parathyroid hormone increases blood calcium, so if there's not enough of it, blood calcium is going to rapidly decline. And this is a serious condition. So notice, find in your book the thyroid gland. See if you can find a picture of the thyroid gland. We may have it up here. Yeah. So in your book on page 68, do you see the parathyroid? Yeah, here's one, but I wanted you all to see it in the book. Okay, so you see the thyroid gland. So the thyroid gland is on your neck. So what we're seeing here is the back of it. So on the back of the thyroid gland, you have those, look like 4 little beads. And those are parathyroid glands. They sit right there on the thyroid gland. So a lot of times people have thyroid problems and have to have surgery. And one of the concerns is with the surgery, the removal of these parathyroid glands. So if you remove parathyroid glands, you're not going to be able to make PTH, right? So the concern is this right here. Hypoparathyroidism, which usually occurs when there's a surgical excision during thyroid surgery. And so now all of a sudden, the person would not be able to produce PTH in sufficient amounts to elevate blood calcium when it drops. So one of the results of low blood calcium is fatal tetany. You all seen that word before? Tetanus. That's where the muscles lock up and can't relax. So remember when you all learned about muscle contraction, how important calcium is in that process. So the muscles tighten up, and that can cause death in 3 to 4 days. So that's an example of a serious condition. So the person would have to have thyroid hormone replacement, where they would be given oral hormones. Okay, and what about this one? So we mentioned this word too, hyperparathyroidism, and that's where the parathyroid gland secretes too much PTH. Now, so if you're secreting too much PTH, what's happening to your blood calcium? It's going up too high, too high. And remember where the calcium comes from the bones. So if you're pulling too much calcium from the bones can become soft, fragile, and deformed. And this is usually the result of a tumor. So tumors, you can have a tumor on your thyroid or parathyroid gland. And usually if there's over-secretion or under-secretion of a hormone, a lot of times the cause is going to be a tumor or some other lesion to that gland. Okay, so calcium and phosphate blood levels increase because they're being pulled from the bone, and that promotes kidney stone formation. Now, and I'm going to pick with you all a little bit here. Do you all remember the cells that build bone and the cells that break down bone matrix? Very good. You said that real quick. Osteoblasts and osteoclasts. So if I tell you calcitonin stimulates one of those cells and PTH stimulates the other cell, which one would you say that calcitonin stimulates? Remember what not calcitonin, but osteoclast. So osteoclast, remember what they do? So osteoclast versus osteoblast. Osteoclast, you remember? Osteoclast break down bone, and osteoblast build bone. Okay, so calcitonin would have an effect on stimulating which of those two? Osteoblast? Why? There you go. So calcitonin lowers calcium by sending that calcium to the bone. So the osteoblast will be working to add the calcium to the bone. Very good. Okay, so osteoclasts then are stimulated by PTH. So PTH increases blood calcium by taking calcium away from bones. So that involves stimulating osteoclasts that have to break down the bone to get the calcium off of bone. Okay. All right. So let's go all the way back, and we'll come back to some of these other disorders. Okay. So here's where I wanted to start. So endocrine disorders, again, you have hyposecretion, which just means there's inadequate hormone release, and hyposecretion may be due to a tumor or a lesion that destroys the gland or interferes with its ability to receive signals from another gland. Head trauma, for example, will affect the pituitary gland's ability to secrete ADH. So what you have to think about here is, what does ADH do? So the effect of ADH on the body is what? What is ADH? Antidiuretic hormone. So ADH causes the body to what? Antidiuretic. Increase water retention by reducing the output of water. Okay? Decreasing urination, holding on to the water. And so the posterior pituitary is supposed to secrete ADH under conditions where there's not enough fluid in the body, like dehydration. So if the pituitary is not able to release ADH, then there's going to be increase in urination, and that's called polyuria. You all should be familiar with that term. Polyuria means excessive urination, and that condition is called diabetes insipidus. So this form of diabetes has nothing to do with blood glucose, nothing to do with blood sugar at all. What this one has to do with is damage to the pituitary gland and the inability of the damaged pituitary gland to secrete ADH. So instead of retaining water, what happens? Excessive urination, so too much water is being lost. Okay? And we'll see that in diabetes mellitus, which has to do with blood glucose, there's also polyuria, but the reason is different. And hypersecretion is where you have excessive hormone release, and tumors or autoimmune disorders are going to cause excessive hormone release. And an example of that is toxic goiter, or you've heard of Graves' disease. So in Graves' disease, the body starts making antibodies that attack your own body. So we know our antibodies are supposed to do what? Right, protect us from foreign invaders. Okay? But when those antibodies turn on our own body, it's called an autoimmune disorder, and that's not good. So here, the autoantibodies are not really damaging anything, but they are confusing the thyroid gland. So remember what TSH is supposed to tell the thyroid gland? Right, so the thyroid gland is not going to make thyroid hormone, T3 and T4, until the thyroid gland receives a signal, which is what? TSH. So TSH is the signal that the thyroid gland needs to start producing and releasing that thyroid hormone. Well, the body is making something that acts just like TSH. So the thyroid gland is being stimulated to make TSH even when thyroid hormone is not needed. Okay? So therefore you end up with what? Too much thyroid hormone. Okay? So that is going to lead to Graves' disease. Thyroid overstimulation. And let me show you another couple of examples of thyroid effects, specifically goiters. So a goiter, and you all should know that goiters are any pathological enlargement of the thyroid gland. So there are what's called endemic goiters and toxic goiters, which we just talked about. So toxic goiters and then endemic goiters. Endemic goiters work in a different way. So remember, in Graves' disease, the thyroid gland is getting an error signal, erroneous signal that there's not enough thyroid hormone, so they're making too much thyroid hormone. With endemic goiter, there's a dietary iodine deficiency, so there's no thyroid hormone. So in order to make thyroid hormone, the thyroid gland needs iodine. So if there's no iodine, there's no thyroid hormone. So now what? So what do you think the hypothalamus is doing? So remember, the hypothalamus is detecting whether there's enough thyroid hormone, and if not, the hypothalamus tells the pituitary gland to release TSH. And TSH is stimulating the thyroid gland, but it's not able to make thyroid hormone, so the levels of thyroid hormone stay very low. And this is what it looks like if that continues for a long time. So here you have, well, the thyroid gland is just becoming enlarged because it's being repeatedly stimulated by TSH to secrete thyroid hormone, but it cannot make the thyroid hormone without iodine. Okay, so a couple of examples of hypersecretion and hyposecretion and the causes there. Okay, and then there are a couple of pituitary disorders here. So you can imagine what growth hormone is supposed to do. So growth hormone causes the body tissues to what? Grow. So if you have hypersecretion of growth hormone, depending on whether you're still at an age where you're still growing or whether you're an adult, you're going to have some of these issues. So acromegaly is thickening of the bones and soft tissues in adults. So adults who start to have hypersecretion of growth hormone have an increase in the size of their hands, feet, and face. So you can see that this is the same person, and their tissues are just getting thicker and thicker. Her tissues are getting abnormally thick. So they're not growing in height because she's, at this point, she's already an adult. But if it's a child, so if you have a child or adolescent, if there's hypersecretion of growth hormone, that can lead to gigantism. And that's where people get really, really extremely tall. Not necessarily healthy tall. They have other problems associated with that, but they get extremely tall. And then there's something called pituitary dwarfism. So pituitary dwarfism, so remember growth hormone comes from the pituitary gland. If the pituitary gland is not releasing enough growth hormone, that's called hyposecretion, and the person may be very small. They won't grow to a full adult height. And this is rare since growth hormone is now made genetically. So they could take synthetic growth hormone to prevent that from happening. Okay. All right, now I want to get to diabetes mellitus. And diabetes mellitus has to do with what? The inability of the body to maintain what? Blood glucose levels. Okay, and this is another one. Cushing syndrome. This is another disorder, but adrenal. So remember, the adrenal glands sit on top of the kidneys, and one of the hormones it secretes is cortisol, and excess cortisol secretion occurs in Cushing syndrome. So in this individual, it's the same person, and you can see how he's kind of blown up. And what that causes is rapid muscle and bone loss due to breakdown of protein and conversion of that the amino acids and little amino acids from the muscles convert to fat and deposit around the face and the neck. And that's called moon face and buffalo hump, I guess, on the back of the neck. And then there's another adrenal gland disorder, and I mentioned this to you all last week. Forgot about this. And this is adrenogenital syndrome. So remember, one of the hormones that comes from the adrenal cortex is what? Androgen. So if there's adrenogenital syndrome, the androgens are hypersecreted. So the body is producing too much of androgens. And what did I tell you all about androgens? They're like testosterone. So when you see androgen, think testosterone. So the effect, just imagine the effect of hypersecretion of testosterone here in an unborn fetus. So when we get to the reproductive system, we'll learn that during the course of development, the embryo is the same, whether it's a male or a female, and then at some point, there's a signal that causes the male organs to start changing. So if it's a boy, there's an increase in a certain chemical, and the penis starts to grow. And if it's not a boy, then the penis stays a clitoris. So the clitoris in females is the same as the penis in males. It just starts to grow if it's a boy. And then the ovaries descend to form testicles. So the ovaries in females are the same as the testicles in males. It's just at a certain point in development, they're told to start making those changes. Okay, so here, this is actually a picture of a female. And you can see that it looks like she has a penis. And so that was because of the increase or the high levels of androgens circulating. And so newborn girls exhibit masculinization, and that's if it occurs at the fetal stages. And if it's an adult woman and she starts producing too much androgen, female will have increased body hair, facial hair, for example, and deeper voice and beard growth. So that's what overproduction of these androgens will do. And that's called adrenogenital syndrome. So I wanted to share that with you all. Okay. Now, so insulin, and this is probably the biggest part that I want to go over today. So insulin, where does insulin come from, first of all? From the pancreas. And so when does the pancreas secrete insulin? When blood glucose levels are Too high. Very good. So blood glucose levels are too high, and that causes the release of insulin. Thank you. Okay. So the next thing is I want you all to think about how is it that insulin lowers blood glucose. We kind of mentioned that last time. And this picture kind of helps illustrate what happens. So when the pancreas secretes insulin, so insulin is this yellow thing up there, and so this is a body cell. So what we said is that insulin, all it does is it doesn't eat the glucose. What it does is tell glucose to go inside the cells of the body, inside the body cells. And this is how it does it. So insulin binds to receptors on the body cells, and once it binds to the receptors on the body cells, there's a glucose channel that opens. Okay, so here the cell can't allow glucose to come in because the glucose channel is closed. So insulin binds to the receptor, and that opens the glucose channel. So glucose comes into the cell. Okay, so once glucose goes into the body cells, it's no longer what? In the blood. Okay, so glucose, the problem is when glucose elevates in the blood. You want glucose to go to the cells because the cells are what's going to use it for energy. So that's what they're doing, allowing that excess glucose to be pulled into the body cells. Okay? So beta cells secrete insulin, stimulating the transport of glucose across the plasma membrane of our body cells. So insulin then is secreted during and after meals when blood glucose levels elevate, and also when amino acid blood levels elevate. So what types of food cause your blood glucose to increase? Carbohydrates. What types of food cause amino acids to increase? Protein. So when you eat a steak, a hamburger, fish, that's going to increase your blood amino acid levels, and insulin will rise and cause those to be sent into the body cells. So insulin stimulates the body cells to absorb these nutrients and stores or metabolizes them, lowering blood glucose levels. And this is an interesting point here. The brain, the liver, and the kidneys, as well as red blood cells, absorb glucose without insulin. So those organs, the cells of those organs are able to bring insulin inside bring glucose inside without insulin binding to them. But all the other body tissues are going to need insulin in order for them to receive the blood glucose. Okay, so what happens when insulin is secreted? So again, it accelerates glucose uptake, stimulates glycogen formation. You all remember what glycogen is? Stored glucose. Very good. And when the body is not able to lower blood glucose levels, that is referred to as diabetes mellitus. And this is the most prevalent metabolic disease in the world. So there's a disruption in metabolism due to hyposecretion of insulin or inaction of insulin. So we'll see that there's diabetes mellitus type 2, type 1, and type 2, and you'll need to know the difference between them. So if a person has diabetes mellitus, whichever type, they're going to experience these symptoms. Polyuria, we just talked about what that is, and that's excessive urination. Polydipsia, you may not have seen that one, but you need to know it. Excessive thirst. And polyphagia, intense hunger. Okay? So if a person is experiencing diabetes mellitus Those are some of the earliest symptoms. And it's revealed by elevated blood glucose, glucose in the urine, and also ketones in the urine if it gets to a severe case. So glucose is not supposed to be found in the urine. So that's one telltale sign that there must be too much glucose in the blood if it's leaving through urine. Okay? And the reason that there's polyuria is because as the kidneys are getting rid of glucose in the urine, water follows. So remember we said water follows salt, will also follows glucose. So that is what leads to polyuria, and because there's too much water leaving with the glucose, that causes dehydration and thirst. All right, so diabetes mellitus is characterized by glucose concentrations high enough to overwhelm the reabsorption capabilities of the kidneys. So hyperglycemia, that's another term you all need to know. Hyperglycemia just means that there's an abnormally high level of glucose in the blood. Okay, hyperglycemia is a condition where blood glucose levels are too high. Okay, and normally hyperglycemia results in the secretion of insulin, which lowers that blood glucose. Glucose appears in the urine, so when glucose is in the urine, that's called glucoseuria. And urine volume generally becomes excessive because of the presence of glucose. Now, so type 1 and type 2 diabetes mellitus, and type 1 is referred to as insulin dependent. Type 2 is non-insulin dependent. Okay, so in type 1, what you have is inadequate insulin production. So type 1 diabetes mellitus occurs when the pancreas is not producing enough insulin. So people who have type 1 diabetes then obviously are going to need what? Insulin. Okay? So they're going to need insulin injections or insulin pump or other devices. And this form of diabetes mellitus accounts for only about 5 to 10% of cases. So most diabetes mellitus cases are type 2. Type 1, though, is also called child onset diabetes mellitus. So usually if a child has diabetes mellitus, it's type 1. And type 2 is referred to as adult onset. Usually occurs after the age of 40, and it's the most common form of diabetes mellitus. Most people with type 2 produce normal amounts of insulin. So what's the problem? There you go. So remember that in order for insulin to work, it binds to the cells and tells the cells to what? Bring that glucose in. So with type 2, the cells are just not responding to the insulin. They're not binding insulin, or they're not allowing glucose to come in, even though insulin is there. Okay, so that is referred to as insulin resistance. Okay, so type 2 is non-insulin dependent because it's not the lack of insulin that is the problem. So type 2 diabetes is also associated with obesity. A lot of times weight loss through diet and exercise can be an effective treatment. Okay, so especially if it runs in your family, you almost have a good idea that it's going to happen to you if you're not, if you don't have the right diet and exercise. Okay. Some of the complications of untreated or poorly managed diabetes mellitus include kidney degeneration, retinal damage, and by retina, you know how important that is, So that's where our photoreceptors are. Early heart attack, peripheral nerve problems, and peripheral nerve damage. And so the kidney damage that occurs is referred to as diabetic nephropathy. So nephrons are what make up the kidneys. So those start to become damaged, and they degenerate, leading to renal failure. So diabetes mellitus can cause kidney failure, blindness. So diabetic retinopathy, the proliferation of capillaries, and hemorrhaging at the retina may cause partial or complete blindness. And her early heart attacks, degenerative blockage in cardiac circulation can lead to early heart attack. So these are all very serious complications that can occur in those that have diabetes, especially if they have it for a long time. Okay, abnormal flow to neural tissue is probably responsible for a variety of neural problems with peripheral nerves, including abnormal autonomic function. And then you have blood flow issues as well, where the extremities may not be getting adequate blood flow and oxygen. Yes. So you may notice if a person has had diabetes mellitus for a while, their feet may get really dark. That's due to low blood flow. And also they have a difficult time with those extremities healing if there's like a cut, a small cut on the foot. You may hear of people having to have part of their limbs cut off because of that. Loss of a toes or a major portion of one or both feet. So those are due to reduced blood flow to those areas. All right, so cells are unable to absorb glucose. So think about that. So those cells that are not able to get glucose must rely on fat and proteins for energy needs. So some of the times you'll notice that people with diabetes may start to lose weight. And that's because the body is feeding off of the fat tissue and the muscle tissue in order to get the energy. Fat catabolism. So fat catabolism just means the breakdown of fat in the body, and that's going to increase free fatty acids and ketones in the blood. So remember how we talked about that when ATP is made, that there's going to be production of H2O and CO2, and also if fatty acids are in the bloodstream, that's going to lead to ketones, which are acidic. And we'll talk more about these a little bit later. That results in ketonuria. Ketonuria promotes osmotic diuresis and loss of sodium and potassium, resulting in irregular heartbeat, as well as neurological issues. And ketoacidosis, another term you'll see, occurs as ketones decrease blood pH. So our blood pH is supposed to stay right at around 7.4. So the blood becomes acidic because of these ketones made by the cells that are breaking down fatty acids. Okay? And these are just some of the other pathological effects of diabetes mellitus. All right. So that's kind of all I had here.